Hi, my name is Ruthie.
Hi, my name is Annette,
And
and
we are
we're from Happy Kids Dental Planet.
Today we will be going over your post-op Frenulectomy kit.
Your kit will consist of ozonated water, which is antibacterial, antifungal, antiviral, fairy balm, a cold ice pack, band-aids, rescue remedy, gloves, Q-tips along with gauze, first Sony toothbrush with 0 to 6 snug pacifiers, and homeopathics. Ruthie will be going over the homeopathics.
Your homeopathics consist of Juja, Staphysacria, Arnica, and Hypericum. For Tuja, you will be taking once a day, 5 pellets under the tongue for 3 days. For Staphysacria, you will be taking 3 pellets each, 3 times a day, breakfast, lunch, and dinner. And I will show you how to dispense it. You twist and you will see that they will be coming out one by one. And please do not touch with your hands. Open the cap and place in the mouth, under the tongue.
With your ozonated water, there will be 2 options of cleaning the Frenulectomy area. Option 1 would be to moisten the gauze and wipe the area. Option 2 will consist of dispensing some ozonated water into a cup and using a syringe and spray bottle, which comes in your kit. You would want to suction the ozonated water into the syringe and release into the spray bottle. And spray the Frenulectomy area after every meal. If your child was instructed to use a gauze band-aid, you will be placing a gauze band-aid into the fairy balm dipped and applied to Frenulectomy area for the first 3 days and change daily. Thereafter, you will be applying the fairy balm to keep the area nice and moist, applying with Q-tips until your follow-up visit. Now, Ruthie will be going over if your child is experiencing any swelling and or discomfort.
It is normal for your son or daughter to experience some swelling, and if so, use your ice pack here, and you can use your rescue remedy 3 to 4 drops daily. I will be showing you how to prepare your brush buddy for the massages. What you do when you receive your kit, remove a nipple from your kit. You're going to cut the nipple a little bit long. Once you have the nipple, you're going to place it over your brush buddy, just like that, and then turn it on and begin your massages.
We will start demonstrating the Frenulectomy exercises, starting with the labial. You want to pull the lip up and back and side to side. This may cause a little discomfort and it's normal. We'll also have the patient do a blow-up fish. And on the upper. Perfect. Then we're going to start doing the mouth massages with the first Sony toothbrush with the pacifier nipple head. You want to go inside and start on the very back of the patient's mouth and work all the way around, being very gentle on the Frenulectomy area. Also want to do the lower and underneath the tongue. Great. Now for tongue exercises, we're going to have to use our 2 fingers Pulling back. And also doing massages with fingers to relax the muscles.